Good afternoon, everyone. My name is Zoila Ramos Albizu from the Consumer Engagement Team, and welcome to Women's Health Webinar. We are committed to the health and well-being of our members and our community, and it's very important for us to provide you with ways to stay healthy and active from the comfort of your home. With me today, I have Diane Deely. She's a registered nurse and a case manager with Blue Cross Blue Shield of Rhode Island Care Management. She helps our members understand the steps they need to take to improve their health care. To improve their health. And she also helps them coordinate the care that they may need along the way. With that, I'm going to give it to Diane, but before I do, I want to let our viewers know that I'm going to be monitoring the comments. So please share your comments and questions as Diane goes through the presentation. Diane, why don't you tell us a little bit more about women's health?
Thank you so much, Zoila, and welcome everybody. Thanks for joining. We're going to talk about health risks facing women. And we'll talk about essential preventive care measures and screening tests, and talk about resources to support a healthy lifestyle and improve your health. Most importantly, please remember that none of this advice replaces the recommendations of your doctors, your healthcare providers. Remember to talk to your doctors, talk to your healthcare providers before you make any changes to your diet, your medications, of course, and your exercise routine. In this modern age, we're all expected to be superwomen, juggling work, home, parenting, grandparenting, and social obligations. Women are often so busy taking care of others that they kind of neglect themselves and don't have enough time to take care of their own health. In this class, you'll learn about special healthcare needs of women and how to keep yourself strong and healthy. Today, we'll concentrate on a few specific health issues that affect women: cancer, heart disease and stroke, depression and stress, Alzheimer's disease, bladder control, and physical activity. The three leading types of cancer in women are breast cancer, colorectal cancer, and lung cancer. Some women are at higher risk for cancer due to things beyond their control, and those things would be their own medical history, or their family medical history, or specific genetic changes that they're in their own personal genetic makeup. Many cancers are impacted by environmental lifestyle factors, and these are the things that are within our control. Things like smoking, sun exposure, physical activity, and diet. Next slide, please. Regular health screenings can help detect cancers early and help you get the treatment that you need. For breast cancer, it is recommended that mammograms or breast cancer screening begin at around age 45. And currently they're recommended every 1 to 2 years, depending on your age and your health risks. And this usually can be decided upon whether it's 1 or 2 years apart between you and your physician. Colon cancer, the health screenings for colon cancer are recommended to begin at age 50. And the screening includes various types of testing now, colonoscopies and stool sample testing that can be done in the privacy of your own home and sent back in. That's called a FIT test. So you can discuss that with your doctor based on what your personal choice and his or her recommendation is. Lung cancer screening can be as simple as a chest X-ray to begin, or a CAT scan for certain people that are at higher risk. Recommended to start on or about the age of 55. If you are a current smoker or have quit smoking in the last 15 years, it would be, recommended to have the lung cancer screening. They talked about pack years of smoking history, and that is a pack year is 1 pack of cigarettes per day per year. So 1 pack per day for 30 years would be 30 pack years of smoking history. Next slide, please. Now we'll talk about heart disease and stroke. Okay, 23% of deaths in women can be attributed to heart disease, even though it has long been thought of as, a disease of males, a man's disease. Okay. The hormone estrogen provides some protection against heart disease until about the age of 55, where the risk begins to increase, and it's believed to be because estrogen levels drop after menopause. Okay, 80% of strokes can be prevented by changing or controlling those risk factors that we talked about that are within our control, the lifestyle factors. But a stroke is when a part of your brain doesn't get the blood supply that it needs. Okay. High blood pressure is the biggest risk factor for stroke. It increases your chance of having a stroke 4 to 6 times. Fortunately, there are many steps you can take to control your heart disease risk and your risk for strokes. Next slide, please. Okay, so some of these things that are within our control is maintaining normal cholesterol levels, controlling or preventing high blood pressure, controlling or preventing type 2 diabetes, managing our stress levels, maintaining on or near a healthy weight, lowering the sodium in our diets, eating more fruits and vegetables, avoiding smoking, being more physically active, and limiting alcohol intake. Next slide, please. For depression and stress, twice as many women as men experience depression. And experts suggest that this could be because of some of the unique changes, the physical changes that women go through during their life cycle. Things like premenstrual syndrome, pregnancy, postpartum depression, menopause. And then there are other lifestyle or cultural situations that also increase the incidence of depression in women. And some of these lifestyle and cultural situations are that more women are living in poverty than men. Women are generally a higher percentage of caregivers for family members, especially family members that are ill. This can lead to a lot of added stress, which is a risk factor for depression. More women are likely to suffer emotional, physical, and sexual abuse. There are stressors all around us, including current world affairs such as the COVID-19 pandemic and political issues that have been heightened lately. Next slide, please. Some coping skills to help with management of depression and stress. And some of these practices include meditation, visualization, deep breathing exercises, have all been proven to reduce stress or the effects of stress on our health. So if you can, make a habit of incorporating these practices, into your daily life. You can start, slow, just a few minutes a day. And there are other very effective coping mechanisms and practices such as yoga or other types of exercise and enjoyable social activities, hobbies, like cooking, drawing, writing, or photography. Okay, a quick fix or something that can help you kind of in the moment in a stressful situation. If you can find techniques to help you manage those emotions as they come up. For example, you can try to find, a quiet place. Even if you're not at home, you can sit in your car for a short period of time, take a walk, do some breathing exercises, and just burn off some steam and kind of collect your thoughts. Evaluate your stress, put things into perspective, even if you can find someone trusted to speak to about your feelings and your life stressors. And make sure that, what you're stressing about, again, is put into perspective and really worth getting all upset about. Be grateful. I'm sure we've all heard of kind of a gratitude journal. Even if you don't write it down, it's good to take a few minutes. I know that was very helpful during the pandemic, is to, when our lives were restricted and we were filled with concern, it was very helpful for me personally to kind of remember each day what I was, what I could be grateful for, turn negative things into positive things. And can really, the gratitude journal can really be helpful. Next slide, please. Now we'll talk about Alzheimer's disease. Women make up 2/3 of all diagnosed Alzheimer's cases in the US. It could be partly due to the fact that women tend to live longer than men, and the chances of developing Alzheimer's, of course, increases with age. New research also suggests that there may be some genetic reasons for the increased incidence in women. There's no definite evidence yet about things that would prevent Alzheimer's, but there are a few theories and things that prevent age-related cognitive decline. As we learn more, health experts encourage people to keep, do the following to keep their mind sharp. Exercise regularly, eat a healthy diet, including fruits and vegetables, develop and maintain a network of friends. So socialization definitely plays a big role. Continue to learn new things, control conditions or prevent conditions like type 2 diabetes, high blood pressure, high cholesterol. Maintain a healthy weight, stop smoking, and get treatment for depression. Next slide, please. Bladder control. Women have a higher risk of having issues with bladder control or urinary incontinence for a number of reasons. These include a weakened pelvic floor muscle system, and that often occurs just having, had pregnancies and childbirth, hormonal changes during menopause, certain medications, high blood pressure medications, sedatives, muscle relaxants can also play a role. And that's something you can talk to your doctor about. Large doses of vitamin C, alcohol, caffeine, carbonated drinks, high sugar drinks, all of these can act as diuretics and increase the amount of urine that your body produces. Artificial sweeteners have been known to play a role. Chocolate, that can't possibly be right, but it's on the list, and spicy and acidic foods. So it's something you can kind of keep track of yourself and see if you can find a relationship between, what you eat and drink and your symptoms. And again, discuss that with your doctor, because there's actually physical therapy sometimes that can help strengthen the pelvic floor muscles. Okay. Manage your medications. Again, talk to your physician about your prescribed medications. Maintain a healthy weight. Excess weight puts extra pressure on the bladder, resulting sometimes in leakage. Stop smoking. Smokers are more likely to have bladder control problems and more severe symptoms. Okay. Also, smokers often have a kind of a smoker's cough, which can, with each cough, provides, exerts pressure on the bladder and aggravates, urinary incontinence. Be as active as you can, as physically active as you can. Try 30 minutes of moderate activity, a day or most days a week. And constipation can also complicate and worsen urinary incontinence. So things like exercise, drinking enough water, high fiber foods will also help prevent or control constipation. Okay, and always have a conversation with your healthcare provider if you're having any difficulty with urinary incontinence or leakage. Next slide, please. Physical activity. 85% of women don't meet the exercise recommendations, and the recommendations are 150 minutes of exercise each week. So that's about 30 minutes, 5 days a week, or you can do slightly more, slightly less, 7 days a week. It's not always easy, definitely not, but here are some tips, some ideas. Do something that you enjoy, do something that is fun for you. It's always great to have an exercise buddy or take hikes with your family, walks with coworkers during the workday, dance classes, kickboxing classes, and kind of keep track on a calendar, cross off the days that you exercise. If you have a Fitbit, or kind of an app on your phone to track your progress, that's also fun. Weekly goals and activities into your day. The old, we've always heard about, don't park in the closest parking space, park far away, take the stairs instead of the elevator or the escalator, things like that. And just, a few minutes a day can make a big difference. 10-minute walk on your lunch break. If you have a pet, take the pet for a walk, things like that. Okay. Next slide, please. Okay, so in summary, we definitely have the power to reduce the risks that we have in our control. Regular health screenings and physicals, stay as active as you can, eat a healthy diet, maintain a healthy weight, and stay in good contact with your healthcare provider regarding any concerns, whether it's stress in your life or feelings of depression, or any physical complaints, that anything new or unusual, and take step towards a healthier you today. Okay, thank you so much. If you have any questions, please put them in the chat and Zoila will share them with me. And if you'd like more support in managing any health condition, you can reach out to Blue Cross Blue Shield and ask for nursing support from the Care Coordination Department. And the number is on the screen, 459-2273. Stay safe and stay well. Thank you.
Thank you so much, Diane, for such a wonderful information. I actually don't see any comments or questions as I'm looking at our comment section here, but I want to give our viewers just a few minutes, just in case if they do have any questions or comments for you, Diane. In the meantime, I'd like to invite everybody to join your Blue Store Studio with the fitness classes that we have on virtually, and also, of course, just like this one, these educational classes that you can then watch at your own convenience at home, from home. I also want to mention something that, Diane, that you talked about, physical activity. And we know that after the pandemic, we were stuck at home. And now that things are getting a little bit better, folks are getting vaccinated, we're kind of going out a little bit more and doing the things that we used to love doing. One of the things that I want to mention to our viewers is the Stepping Out Outdoor Fitness that we started back in April. And we're basically going to different places, parks in the state of Rhode Island. And we want our members to enjoy those fitness classes. Similar to the fitness classes that we're providing via our Facebook, we're providing those in person at our parks. And I'll include that information shortly so that folks have that information so that they can come and see us at one of these parks where we're going to have these fitness classes. I don't see any comments or questions here for you, Diane. At this time, we're going to go ahead and close the presentation. I want to thank you for the wonderful information. And again, for folks that are viewing or maybe going to be viewing it later, if you need to get in contact with Diane's team, again, the phone number is 401-459-2273. I want to thank everybody again for joining us, and you have a great day. Take care,
Thank you.
everybody. Until
Bye-bye.
next time, take care.
Bye.